Hi, I'm Dr. Sharbell Hashoul, and today let's talk about something that confuses a lot of people. Why some countries tell women to get a mammogram every year, while others say every 2 years is just fine. If you've ever compared notes with a friend or family member living in another country, you may have noticed this difference and wondered which one is right. Here's the reassuring answer. Both approaches come from careful research, and the difference isn't about one country being careless and another being extra cautious. It comes down to how experts balance a few key factors. First, let's talk about what screening is actually trying to do. A mammogram is an X-ray picture of the breast, used to look for cancer before it causes any symptoms, when it's often smaller and easier to treat. Screening guidelines are built by looking at large studies of thousands, sometimes millions, of women over many years, tracking what happens when mammograms are done at different intervals. So why the different conclusions? One big factor is the balance between benefit and downside. Screening more often can catch cancers a little earlier, which sounds like it's always better. But more frequent screening also means more false alarms. Cases where something looks suspicious on the mammogram but turns out not to be cancer after further testing. Those false alarms can cause real anxiety and lead to extra tests or biopsies that, in hindsight, weren't necessary. Health systems and expert panels weigh this trade-off differently depending on their data and their values around minimizing unnecessary procedures versus catching every possible cancer as early as possible. Another factor is the population being studied. Breast cancer risk isn't identical everywhere. It can be influenced by average age, genetics, family history patterns, and even breast density, which refers to how much of the breast tissue is glandular versus fatty, since dense tissue can make mammograms a bit harder to read. Countries base their guidelines on research done in their own populations, so naturally, recommendations can differ slightly. Cost and healthcare system capacity also play a quiet but real role. Running a national screening program every single year for every eligible woman requires enormous resources, machines, radiologists, follow-up appointments. Some health systems have looked at the data and decided that every 2 years captures nearly all the benefit with fewer resources and less unnecessary testing, allowing them to extend screening to more people or age groups overall. It's also worth knowing that guidelines are not set in stone. They get revisited as new research comes in. You may have seen headlines over the years about groups changing their recommended starting age or interval. That's not a sign that experts don't know what they're doing. It's the opposite. It shows the guidelines are being actively updated as we learn more. So what should you actually do with this information? Here's the practical takeaway. Don't try to self-diagnose the correct interval by comparing countries. Instead, follow the guideline that applies to where you live, and more importantly, talk with your own doctor about your personal risk factors, things like family history, certain genetic factors, or prior breast conditions might mean your doctor recommends a different schedule than the general population guideline, and that's completely normal. Screening isn't one size fits all, even within a single country. The bottom line is this: whether the guideline in your country says 1 year or two, it was built by people looking carefully at real evidence, trying to find the balance that helps the most people while causing the least unnecessary worry. Both approaches are trying to protect you, just with slightly different math. As always, this video is meant to help you understand the bigger picture, not to tell you what your personal screening schedule should be. Please talk with your own doctor about what's right for you based on your history and your health. Thanks for watching, and take care of yourself.